My name is Muli Musyoka. I'm a trichologist. I run a clinic called Hair Hub Trichology Center, and I've been in the hair restoration business for 14 years now. And there's a question that I've received a lot around the difference between permanent hair loss and temporary hair loss. And today I want to talk about the difference and what brings them about. Temporary hair loss is simplified as forms of hair loss that the hair follicles are left intact by whatever thing is causing the hair loss. And this could be just shock fall, postpartum hair loss. It could be deficiencies or mineral deficiencies that then leads to shedding of hair. It could be stress related that leads to shock of the body and collapse of the growing phase of the hair and moving to the shedding phase. Like we have chronic stress would lead to telogen effluvium. We could have acute stress like food poisoning that leads to anagen effluvium where the hair falls off during the growing phase. Now, these are conditions that you will experience hair loss either in patches, but the follicles remain intact. So as soon as you fix whatever is causing that form of hair loss, then the follicles will be able to produce hair optimally and you will get your hair back. Now, on the other side, when we talk about permanent forms of hair loss, now these are conditions whereby mostly they're autoimmune related, where patients will have white blood cells or a group of white blood cells attacking their own hair follicles and decimating them. And mostly the hair follicles are attacked around the sebaceous gland and the arrector pili muscle, which is where we call it the bulge area, which is where the stem cells of your hair follicles are generated. Once that area is affected or you get inflammatory process going on there and the follicles or those structures of the follicles are damaged, then in most cases the patient will have permanent loss of hair, because once we lose hair follicles, the body cannot generate new hair follicles. We develop hair follicles when the fetus is developing, between 14th and 22nd week of fetus development. After we are born, our bodies do not generate new hair follicles. So if something happens, even accidents that you get a scar that is so deep the follicles were damaged, then you expect not to grow hair because you suffered permanent loss of follicles, hence permanent loss of hair. Now, there are conditions that will start manifesting slowly. I've in the past spoken about things like frontal fibrosing. I've spoken about folliculitis decalvans. I've spoken about lichen planopilaris. These are conditions that slowly but surely white blood cells get into this idiopathic activity of decimating your own hair follicles, and innocuously you lose hair follicles day in, day out, and it leads to a permanent loss of hair. Now, most people will be trying things. You want to Google stuff and say, this is what my friend did, and you want to do that. For instance, something called frontal fibrosing can actually be quickly confused for traction alopecia, which by the way is another form of hair loss that if done repeatedly, you can yank out the hair follicles and you end up losing hair permanently. It's always very important that when you notice that you're losing hair and the situation is continuing to happen week in, week out, month in, month out, it's extremely important that first you go and get a proper diagnosis. Please note, getting a diagnosis does not mean that you're forced to do anything about it, but it is important to know whatever is happening is not something that is posing the danger of losing your hair permanently. The earlier you diagnose hair loss and start doing something about it, at least to make sure that you do not continue losing hair, the better for you. If you wait, it might actually cost you your hair, cost you your hair follicles, cost you money, cost you emotionally, and it drives down how you feel about yourself. What am I saying? Any form of hair loss that you're experiencing is worth taking some time off, go see a specialist, understand what is going on and what your options are. Otherwise, I wish all of you good hair days in the future.